Geovanni Cantizano from the Puerto Rican Action Committee, PRAC of Southern New Jersey, is a lead-free New Jersey community hub leader, a provider, and also a provider of the New Jersey lead removal grants through the Department of Community Affairs, and here to discuss community organizing and outreach. So, Geovanni, even though we can't see you, we will hear you, and thank you so much for joining us.
Well, thank you for having me.
Thank you.
And I apologize. Can you hear me? Hello?
Yes, we can. Yes, we can.
Hello? Okay, sorry about that. So once again, I apologize for not being able to get on camera here. But thank you for having me. Glad to be here. As mentioned, we're PRAC of Southern New Jersey is one of the 58 agencies grantees that has received funding from the Department of Community Affairs in order to address lead hazards out in South Jersey. So we currently cover Salem, Cumberland, and Cape May counties. And we certainly see our fair share of that 25% housing stock out in at these locations. We have been in operation for about 2 years now, and every day is something new. We learn something new. We're here today to talk about one of the things that we'll talk about is outreach and what we're doing in terms of that outreach and community organizing as well. But the outreach we're focused on the Cumberland County area at this point, although we do some outreach in the Salem and Cape May County areas as well, but where the main focus is Cumberland. As a result of the greater numbers that we see in Cumberland County, not to mention the high levels of blood lead levels that are upon testing that we see in the county as well. We are fortunate to work with both the Violin Department of Health as well as the Cumberland County Department of Health, both of which are great and seem to really care about communities that they're serving. The outreach efforts, again, in Cumberland County, we are knocking on doors, from out in Violin and Bridgeton at this point, two of the three larger cities in the county. Millville, we will be placing some focus in that area as well, more focus in that area as well soon enough. But we are participating in monthly events that are both internal, whether by other programs, sister programs, and as well as events that are hosted by other organizations and partners. It's funny. As much information as many times as we get out there and talk to folks, it never ceases to amaze me the number of individuals that we come across that really don't have an idea how bad the effects are of lead, and frankly don't even know that there's lead in their homes, whether it be homeowners or renters. And at this point, I believe that landlords are to share some information regarding any lead hazards that may be present if they have not already been addressed through any remediation or abatement efforts. But I'm really surprised at the number of folks that don't have any idea. And I think that as part of the community hub for Southern Jersey, our focus is to educate community members about the dangers of lead exposure, the roots of the exposures, whether it's through paint, soil, water, which we're learning a little bit more about, dust, and so on, and really promote the testing of the homes and children. When you look at a million homes across the state, and you think about that 25%, it almost seems like 58 agencies or grantees to do the work is not enough. We can't move fast enough to be able to address all of these homes and what I would say a timely fashion, which is yesterday. So DCA is certainly doing a lot of good work in terms of outreaching, getting information out there, coming up with the CRM system where it facilitates, to some degree, facilitates the process of applying for services. My concern there a little bit is that those folks that unfortunately do not have the reading levels or comprehension or even the language barriers that exist in order to even begin trying to get into such a system. And it's the good thing there is that those that are reached on a face-to-face basis, whether it be through an event or visiting the office or cold calling or whatever the case may be, we're available to be able to assist in the application process. So that facilitates a little bit, but we still have some other areas of concern that I think that need to be further addressed. But so with the outreach, we continue to plug away. Again, whether it be knocking on doors, whether it be cold calls, whether it be these community events or presentations and individual organizations such as the churches and whatnot that give us the opportunity to share the dangers and the hazards of lead exposure. And our efforts also, as I mentioned earlier, we need to part of our intention is to share information with the folks out in the community, but also getting them involved and kind of providing a way in which their voices can be heard. And that's where the community organizing will come in. We're currently working, looking to hire two individuals, one that will coordinate all efforts for the operation for the hub, as well as someone that will assist in the outreaching process as well. But once we have those folks on board, our intent is to once again identify those partners and other stakeholders that to be able to have them join the good fight, if you will, and hopefully be able to share information, expand that, identify folks that are needing the support, as well as identifying those that can champion the cause, from council to mayors to religious leaders, and certainly, I think, and most importantly, community members and residents. They have a lot of power that goes by the wayside when they don't get involved. But our process basically, we identify referrals in multiple ways. We via outreach, word of mouth, folks that call us, landlords that reach out, and those are both abatement and remediations. However, in order for us to be able to work with those abatements, there must be a referral coming from the Department of Health. And as I said, we work closely with Cumberland County, Vineland, Salem as well, and just starting to pick up things in Cape May County also. But those referrals in order for us to be able to address those abatements. Once they, in a brief overview, we go through the application process, determining eligibility. Once that eligibility is ascertained, and those cases are moving forward, testing, of course, has to take place, and we do a simple swab test just to identify that there is lead present. And then we bring in the big guns. At that point, a risk assessor comes in, professional firm, also certified by the Department of Community Affairs to provide and deliver the service. Excuse me. And they come in, do their work, their magic, send us those risk assessment reports, which allow us to then create those scope of work and be able to discuss it with the pool of contractors. We work with a pool of contractors and discuss it with the contractors. And we work that on a rotating basis, if you will, and try to look for the lowest bidder, trying to protect those taxpayer dollars. And once we have a pricing in place and negotiated, we discuss the scope with the homeowner, the renter, and the landlord. And obviously, in the case of a landlord, they're the ones that provide authorization for all the work. If it's an abatement, walkthroughs and whatnot, inspections are done with the Department of Health, along with the Department of Health. The work gets done, they approve the scope of work. And at that point, the work begins. Clearances are scheduled. They come in. We come in, do an inspection as well as the Department of Health for, again, those abatements. And pretty much the same process for the remediations, except the involvement of the Department of Health. And once that's in the clear, they'll let us know. Meaning the Department of Health will let us know everything is cleared on their end. The risk assessor also provides the clearance reports, indicating that it's good to go on their end as well. And at that point, those results are shared with renters, homeowners, and landlords for their records. At that point, the new law that was implemented and has gotten some revisions since. I still struggle myself, and certainly some of the landlords that we have come across, kind of identifying what some of the what would it be, whether the municipality goes with the visuals and the rights, or one or the other, or both, and what that process is for them to be able to get the lead-free certification for the abatements. That's a little tougher than the certifications for lead safe. So it's one of the things that we want to focus on. I think that the collaborative, Lead-Free New Jersey Collaborative, has done a great job in involving quite a lot of knowledgeable folks, and that share quite a lot of information. Has a very strong steering and advocacy committee that certainly provide a whole lot of information and support. And again, I'll be talking soon to Ms. Heather Sorge regarding her expertise in terms of the community organizing that we are about to undertake. So hopefully we'll come up with a good plan of action and start making things happen.
I love that,
That's all
Geovanni. I love that. And you gave me a great segue to ask everyone to join, get involved in this effort, and sign up to be a member of Lead Free New Jersey and participate in one of the committees that Geovanni just mentioned, to get involved in the advocacy, but also take this information back to your communities, about the state laws that are in place, that Elena and Jennifer spoke about, and also the Sustainable Jersey actions that Melanie spoke about, and get in touch with Geovanni and others on this free lead paint remediation. It's a great opportunity right now. And thank you so much, Geovanni. We did actually end right on time. So I
Did
think
you
we
see
have some.
that?
Wow. I kind of stole the thunder from Matt, sorry. But if anybody has any questions, we have time for people to go off mute and have a conversation.